Hey everyone, Dr. Ben here with the Functional Medicine Centers, and I am a full-time practicing chiropractic physician. I practice in Fort Collins, Colorado. We've just opened up our satellite office, the Functional Medicine Center of Arizona. It will be in Phoenix, and we're actually starting COVID-19 antibody testing there this week as well. I've been in practice since 2001. I've seen a lot of things change over the years, and yet some of the basic principles remain the same. And that's what we're going to be talking about today. We're going to be talking about your thyroid, and we're going to be talking about your immune system and how they interplay with each other, and how the thyroid can affect the immune system, and also how the immune system can affect the thyroid. And in today's day and age, obviously, immune system is everywhere, and that's what we're hearing about all the time. And can we fight off viruses, and can we do all these things? There's actually a lot of research and things that we're seeing now that are showing that viruses actually have a huge effect on the thyroid itself, which we'll get into in a little bit here as well. So for those of you that I haven't met yet, and that don't know my story, I got into this whole functional medicine side of things a long time ago, and very specific reasons why I did. Some of those basic things, when I first thought about what I was going to do as a career, I was led by some very important people. One of the first things that happened in my life, health-wise, was that I broke a bone in my wrist playing football in high school. I had a cortisone injection done. They said that they could do a surgery, and yet I'd have less range of motion than I had at the time. And that didn't sound very good. I threw shot put, discus, had a scholarship to Syracuse, and was on the path of going to do that, and I broke my wrist. Wasn't getting the results, didn't want to do drugs, didn't want to do surgery to do that. My mom was seeing a chiropractor at the time for health issues related to a motor vehicle accident, and he said, yeah, bring him in and we can work on that. We can work on the wrist. 4 or 5 sessions, great results, was able to get that range of motion back. I don't even notice that anymore. It healed without any surgery, anything like that. That led me down the path to say, wow, this is pretty cool. He had me come in. I went around with patients, saw what he did, and I said, this is what I want to do. At that same time, my mom was getting diagnosed with MS, multiple sclerosis, which is an autoimmune condition and something we'll be talking a bunch about today as well. And she got diagnosed with MS, ended up going on disability, and that was way back in the 90s, and she was on every drug out there. Hey Brian, how are you? She was on every drug out there for MS, and she got to the point where she was in a wheelchair. She'd have to go around the go-kart when she'd go to Walmart, use a cane, and was on this downward spiral. She found a great doc when I was in school, and they started working together and started reversing a lot of the issues that were contributing to her MS. And the amazing part was she had another MRI done about 20 years ago after they had worked and rebuilt and repaired all these different systems, and she no longer had any plaquing on her brain or spinal cord for that. That led me down that path of, wow, how can somebody truly heal from an autoimmune condition, especially something like MS, where now my mom is 77 years old. She does granny boot camp. She does burpees, fishes all day long, all these different things where 99% chance she would be dead at this point if she hadn't found this functional medicine approach. And so that's what led me down this path. That's what drives me every single day. And I know that autoimmunity can be reversed, can be healed. We reverse MS, rheumatoid arthritis, lupus, all types of different autoimmune conditions every single day. So that's something that's very much related to the thyroid, because what we know is that the thyroid, 80% of low thyroid state in patients is going to be from Hashimoto's, which is an autoimmune disease. And we know that if that immune system is out of balance, that especially infections, getting something like a virus like Epstein-Barr or potentially even this COVID-19 can contribute to that low thyroid state. So what I'm going to be talking about today is thyroid function, how the thyroid works, but also how that immune system plays a role into the thyroid itself, and what you can do to boost your immune system, but also boost your thyroid and get your thyroid working better and downregulate that autoimmune cascade. Just like my mom that had MS, now she doesn't. She was able to reverse the damage, but also stop the damage that was going into the body at that time. So here we are then with the thyroid, and we're going to get into that physiology. We're going to get into where things go haywire and what happens as we go through this process of figuring out what is contributing to really why somebody has a thyroid problem. So let's start with the basics. Where is the thyroid gland? Thyroid gland is in the throat. They call it the butterfly shape to it. The thyroid controls a lot of different things, but primarily metabolism, and it kicks out hormones. T3 and T4 are the main thyroid hormones produced by the thyroid gland. So the thyroid, very important. If somebody has low thyroid, what symptoms are they having? They're having fatigue, overweight, their hair's falling out, maybe they're crying at commercials. Any of you guys cry at commercials out there? It's going to be, so that emotionality is going to be there. Sometimes slow digestion can be part of that process. A lot of different things can come about if somebody has low thyroid state. The opposite is going to be high thyroid, which is going to be hyperthyroid. And that's a lot of times the opposite of those low thyroid symptoms. So that's going to be heart's racing, the metabolism really high, they can't lose weight. Anybody out there with low thyroid that would want to go high for a little bit? But if you know anybody that's gone hyper, they're going to tell you 9 times out of 10 they would much rather go low than go high, especially people that are swinging up and down. I had one lady at a thyroid workshop one time, and she said, looked at her husband and said, when I was really high, I wanted to punch him in the face. It was that intense. So hyperthyroid can be just as problematic or worse than low thyroid. So think about low thyroid as kind of that sluggish, high thyroid as this overreactive side and just this hyper state in the body. But what can happen if somebody has autoimmune or Hashimoto's, they can actually go up and down, up and down, up and down, and actually experience both. So not all hypothyroid or Hashimoto's patients are 50 pounds overweight, sluggish, Some of them look just lean and almost healthy, but they are swinging up and down, up and down, up and down with that Hashimoto. So let's start with the basics then on what the thyroid does and where it goes. So thyroid, I'll start here with this basic picture. And the thyroid is going to be stimulated, here's your thyroid, it's going to be stimulated by what is called the pituitary gland. And the pituitary gland is right here, kind of in that third eye, if you had a bindi like they do in India, that little bead there. The pituitary is what they call the master gland of the body. And the master gland of the body is going to tell the thyroid what to do, but it also tells the adrenals, and it's going to tell the male and female hormonal system what to do. So estrogen and progesterone for female cycles, it is going to be contributed to by that pituitary gland. It's going to secrete LH, luteinizing hormone, and FSH, follicle stimulating hormone. And that's what's going to give you your cycles and help you get pregnant and all those different things. So the pituitary is going to tell the thyroid what to do. And then the thyroid is going to kick out the T3 and the T4. And those are going to be the main thyroid hormones that are produced. So many of you watching are going to be on what is called levothyroxine. And levothyroxine is, guess what? The #1 best-selling drug in this country. Anybody know that? Okay, give me a thumbs up if anybody knew that. Thumbs down if you didn't know that. But again, levothyroxine, T4 hormone, is going to be the #1 best-selling drug in the United States. That's pretty amazing, isn't it? That of all the medications out there, T4 levothyroxine is the most prescribed, best-selling drug in the entire country. So what does that tell us? There are a lot of people, over 20 million people are on thyroid medication, levothyroxine specifically, over 20 million. There's also Synthroid, there's Armour, Nature-Throid, different types of thyroid hormones, which we'll be getting into down the road as well. But it's very, very prevalent, and unfortunately, I was just looking at WebMD a little while ago, a couple days ago, and it's interesting what they say. Especially, I was looking up Hashimoto's, and unfortunately, WebMD pops up #1 now for almost everything because of how Google changed its algorithms. And on WebMD, they talk about Hashimoto's, and they say Hashimoto's, it's an autoimmune disease that attacks the thyroid, and your doctor will prescribe levothyroxine and will stabilize your thyroid that way. So how many of you guys have been on levothyroxine or some type of thyroid medication and it hasn't worked? Millions of people, that's been the problem. And what we're looking at is that it's not just going on that medication. And so, it's really sad that WebMD actually says that, because so many people, just especially with Hashimoto's, will never be at the right level, will never feel good going on that medication. And I'm going to show you why today, why levothyroxine, yes, some people need to be on thyroid medication, but it's never going to be that be all and end all and fix everything. So Terry, I see you know what I'm talking about out there. So if you guys have questions throughout the process, go ahead and put them down below. We saw Carol there. How are you? Is dry skin also a symptom of low thyroid? Yes, so dry skin definitely is going to be more of a hypothyroid symptom. It could come with hyper, but definitely we see that dry skin more so with hypothyroid. So great question there. So the pituitary gland tells the thyroid what to do. The thyroid kicks out T3 and T4. If you guys want to make notes at home, go ahead and write some of this down. 93% of that T4, of the thyroid hormone coming out is T4, 7% is T3. Well, that's really interesting, and it has a huge part of what is going to be affecting the body here, because we say that this T3 is the active or usable form of thyroid. So T3 is going to be active, usable form, and yet we're only making 7% of our thyroid hormone T3. So that means that we have a need for T3, but we're making the majority of its T4, so we need to actually convert T4 to T3, and I'll show you down the road what that means through there. So the pituitary gland tells the thyroid what to do. Thyroid kicks out that T3 and T4. And why is the pituitary so important? Well, a big part of what we're looking at. Hey, Stacy, read the book Stop the Thyroid Madness. Good book. Yes, there's a lot of good books out there. My favorite and the godfather of thyroid, especially Hashimoto's, is Dr. Datis Karazian. And anybody that's doing any Hashimoto's or thyroid work now, they've trained under Dr. Karazian. He's amazing. So pituitary, why is that so important? Well, the pituitary also tells, so that's a kidney gland and that's your adrenals. The pituitary tells the adrenals what to do. And so how can the stress and the immune system and all the things that are going on now in your life affect the thyroid? Well, think about this. If you are under this constant stress, whether you've lost your job, whether your business is shut down, whether your kids are home and you're trying to homeschool four boys like my wife is, bless her heart, say a couple prayers for her out there. If you've got this stress going on, your pituitary, we call the pituitary the jockey. So remember, the jockey's riding the horse and whipping that horse. The jockey is whipping the horse over and over and over and over, and eventually that jockey gets tired. And if that happens, we will not just see adrenal issues and where we're not stimulating the adrenals like they should, but we will actually see the pituitary not telling the thyroid what to do. And so we see a lot of different scenarios with the thyroid gland, but one of the big ones that we'll see is low thyroid secondary to hypopituitary. So again, for those of you that have watched some of my videos, this is Saturday. We're going to get a little more technical. If you've got questions, go ahead and put them out there. But this is that deeper dive that we're going to go into rather than just a 3 to 5 minute video. I'm going to be on here as long as we need to get through this. So stick with me here. The pituitary gland tells the thyroid what to do, but it also tells the adrenal glands what to do. The adrenals are our stress glands. Anybody have stress out there? Jobs and cars and kids and presidents and lockdowns and oh my gosh, am I going to get this virus? Looking at Facebook of all places, mainstream media, all these things, we're getting inundated. Stress, and that's going to actually wear out the jockey, wear out that pituitary. So we've got to be able to help our body on a lot of other levels besides just here's your levothyroxine, here's your thyroid support. Stacy, Dr. Kharrazian, Datis, D-A-T-I-S, Kharrazian, K-H-A-R-A-Z-I-A-N. There may be more than one R in there, but it's Datis Kharrazian, best thyroid book out there. Again, we've got to make sure that all aspects of stimulation to the thyroid are working like they should. So down-regulating that stress response, meditation, calming, mindfulness, prayer, all these different things. But guess what? The number one stressor to the adrenal glands is. For those of you that have watched any of my videos, we've got probably 200 videos on here on Facebook as well as on YouTube. I've talked a bunch about blood sugar, and the number one stressor to the adrenal glands is blood sugar swings, especially the dips. So every time that blood sugar crashes down, it's going to stimulate the adrenals to try to regulate it. So that blood sugar crash is going to be the biggest stressor that we have to the adrenals and ultimately to the pituitary and ultimately stopping the thyroid from doing what it should be doing. And so we need to be able to stimulate the thyroid appropriately at first. And that is a big part of where this whole process starts. Hey, Melissa, what causes a puffy face? What helps it go down? So a lot of times the puffy face or just swelling in general is going to be an inflammatory process. When we get started working with patients and we calm down that inflammatory cascade, and not even necessarily stabilizing the thyroid yet, but even in the first 2, 3, 4 weeks, people's swelling, they drop 5, 10, 15 pounds in the first 30 days just because that inflammation and that swelling goes down dramatically. So what we're going to look at is hypothyroid and Hashimoto's is an autoimmune condition with a major inflammatory cascade going on. And so as we start fixing the whys, because here's the deal. Remember, when we're talking about thyroid, when we're talking about fixing the thyroid or that autoimmune reaction and fixing that immune system, it's not about a Hashimoto's protocol. It's not about fixing the thyroid. It's not about fixing Hashimoto's. It's about fixing what you find and fixing the systems that are out of balance. And that's the big thing that we've got to do is fix those underlying whys. And if your blood sugar, if your immune system, if you've got an infection, if you've got low vitamin D, all these different things are out of balance, you're going to be getting inflamed. And that's one of the big things when we look at these cofactors. New York University just did a study of the first 4,103 people that died from COVID-19 in New York City, and they found the number one issue with those people, the number one symptom that was consistent between the majority of them was obesity or being overweight. And that was the underlying factor that led to ultimately that fatality and that death in those people. So what does that mean? Well, that's an inflammatory process. And it's not obesity or being overweight is not the inflammatory process, but that inflammation led to them being overweight and obese. And that's the big thing that I want people to figure out every single day is that being overweight is not the problem. Being overweight is the symptom. And that means that your body is inflamed. It means your body is saying, oh, this is weird. I got to hold on to this body fat. What am I going to do? And so it needs to hold on to that body fat and hold on to it, hold on to it, hold on to it. So long term, we've got to fix the underlying whys. There is no thyroid protocol, thyroid solution. If you look at Dr. Kharrazian's book, there's like 27 different patterns of thyroid dysfunction that he talks about in there. So which one are you going to pick out? And that's the biggest thing, is you've got to know what's going on. So the first place to start is, what is that pituitary doing? So this is what it looks like. If you've got your blood work there at home, look at this. TSH should be between 1.8 and 3. Thyroid stimulating hormone. That's what comes out here. TSH should be 1.8 to 3. And it might be reversed for you guys, so I'm not sure if you can read that or not, but 1.8 to 3. So thyroid stimulating hormone, if it's below 1.8 and you have low thyroid hormone, T3 and T4, that's indicative of a hypopituitary causing that hypothyroid. So that's the first place to look. Is the pituitary stimulating like it should? And if it's not, then a lot of times it is because of the adrenals. It's because someone has had this chronic stress. If you look at 8 to 1 female to male ratio of hypothyroid issues and Hashimoto's issues, not surprising. Women have female hormones that they have to deal with. They've got stress of having babies and kids and raising the family, plus probably doing job on top of it and all these different things. It's very stressful to the adrenals, and that's going to ultimately wear out that pituitary as well. So what are we at then? So first step is the pituitary working? Is the jockey whipping the horse to do what it's supposed to do? That's the TSH. TSH tells the thyroid what to do. Thyroid kicks out T3 and T4. 93% is T4, 7% is T3. T3 is the active form, meaning that's the hormone that's going to go to the cells ultimately and do what it needs to do to pick us up and give us that metabolism. So T4 has to convert to T3. And so ultimately, what that means is we're going to take T4, and in the liver and in the gut, 60% of that conversion takes place in the liver, 20% takes place in the gut, and the T4 is going to convert to T3, and that is transported around the body on a bus, and that's the thyroglobulin. And this will be important as we start talking about Hashimoto's a little bit more in depth here. So again, pituitary tells the adrenals what to do also, but it tells the thyroid what to do via TSH, 1.8 to 3. So if you have your blood work at home, get that out and look at those numbers. You want that between 1.8 and 3. If you're on medication, you want that around 1.0. Then you have T3 and T4, and when you look at blood work, you need to look at free and total T3 and T4. I just had somebody commented on Facebook, and they said, or it was a direct message, and they said, my endocrinologist said that T3 and T4 fluctuates way too much, so all we look at is TSH. I tried not to laugh because that's really not an accurate statement, and I'm very surprised that an endocrinologist would say that, because we'll see TSH can bounce up and down, up and down, up and down, and we'll see it fluctuate 2, 3, 4, 5 points. If you tested TSH every single week, it's going to bounce all over the place, especially with Hashimoto's, where the T3, T4 are going to be pretty consistent. If it's low, it's going to be consistently low. If it's high, it's going to be consistently high, unless somebody goes into an autoimmune flare or something like that. But ultimately, we've got to check T3 and T4. And the reason is we need to know, are we actually making enough thyroid hormone? But guess what? Some people that make enough thyroid hormone, they're not transporting it around the body like they're supposed to. And that is going to be one of the first signs of Hashimoto's, is if you have a decent number of T3 and T4, it's not really, really low, and you're having hypothyroid symptoms. That means that you're not going to be transporting your thyroid hormone around. Thyroglobulin is going to be that transportation mechanism. It's going to be turning that, it's going to be moving that around the body. So with this thyroglobulin, we're going to be transporting that T3 and T4, and we're going to be moving that around the body, and then ultimately getting it to the liver and getting it to the gut, where we'll convert it into this active form, which is the T3. But in Hashimoto's, this is an autoimmune condition, and autoimmunity is going to rev up that immune response. It's going to tag things for destruction. So normally, let's say somebody has a virus that comes into the body, and that virus is going to get tagged for destruction. So this COVID-19, and you've heard about these antibody tests that they're talking about, they're looking for antibodies that are going to tag the virus and say, next time it comes in, tag it, destroy it. So if you had chickenpox as a kid, you're going to have antibodies to that virus, and the next time your body gets exposed to it, it will tag it and it'll destroy it before you even have a symptom. But what happens in autoimmunity is those antibodies aren't produced against a virus, a bacteria, a parasite, things like that. It's actually produced against our self. Auto, meaning self, immunity. So for those people, they're tagging their thyroglobulin, and the immune system is coming in and saying, hey, I'm going to attack and I'm going to destroy whatever that is. And in this case, it's the bus that transports the thyroid hormone around the body. So this is really important to remember, is that we have transportation of thyroid hormone, which is just as important as looking for autoimmunity to the thyroid itself. And we'll see autoimmunity to the thyroid and autoimmunity to the bus. But somebody may have plenty of thyroid hormone, and we see this all the time, but they're not transporting it around the body. And the number one reason for that is that they have autoimmune, and the immune system shot out the tire of that bus, and it is not able to transport it around. So that's one of the big things that we look at is, can we transport the T3 and T4 like we should? And we need that T3 and T4 transported because it has to get to the liver and has to get to the gut to convert T3 and T4. So first stage that you're looking at is the pituitary telling the thyroid what to do appropriately? Do we have enough stimulation there? Do you have enough TSH? And some hypothyroid people actually have low TSH, low pituitary hormone, which is usually reserved for people that have high and they're trying to slow it down. So sometimes it's inverse like that because the pituitary is worn out. And then we've got to see, do we have enough of the T3 and T4? Do we have enough of the thyroid hormones? And then you've got to see if you do have enough, but you're still having hypothyroid symptoms. A lot of times it's that thyroglobulin, one, is being attacked. Two, is going to be if there are hormone imbalances, specifically estrogen. And if we have excess estrogen or estrogen imbalances, then we're going to have problems where that thyroglobulin even can go too much sometimes, and then it's almost like a traffic jam. You guys don't have traffic jams right now because everybody's staying at home. It's almost like a traffic jam where we're not able to get that thyroid ultimately to the tissues. So you've got to check pituitary and TSH, you've got to check the thyroid hormones, you've got to know what's going on with the thyroglobulin, and then you've got to see what's going on in that liver and gut to know if we're converting the T4 to T3. So T4 gets converted into T3. Remember, 93% of the hormone coming out is T4, 7% is the T3. And we have to convert the T4 to T3. T3 is the active, good, usable form. Okay? So T4 to T3. So one of the things that I see all the time with patients is they have plenty of T4 and not enough T3. Guess what levothyroxine is? Levothyroxine is T4. Levothyroxine, number one best-selling drug in this country, over 20 million people on levothyroxine. They're getting plenty of T4, but they're ultimately not getting it to their T3. They're not converting it over to that T3. And that's what we'll see, where people will be, anything over 7 is pretty good on T4, and we'll see 7, 8, 9, and 9.5, and plenty of T4, but not enough T3. And that's what I'll tell patients all the time. I'll say, hey, if we start converting, you're probably gonna be able to take less thyroid hormone than if you weren't converting that appropriately. And usually within 6 to 12 weeks, they're able to start decreasing their thyroid hormone because they don't need as much, because they're actually getting it to the tissues like they need to. Okay, so thyroid hormone ultimately to the tissues is very important for the immune system as well. Having enough thyroid hormone is going to get our system to be able to function like it's supposed to. And what we're looking at is that if we can get the thyroid hormone to the tissue, that immune system is going to be able to function like it should. Terry, 7, nowhere near that. I'm talking about total T4 on that one, not free T4. So if you were confused on that, I was talking about total T4 being at 7. So again, thyroid hormone is crucial for our immune system to function like it should. It's going to activate the neutrophils and the macrophages to be able to attack and be that first line of defense if something comes into the body. And if we have low thyroid hormone, that immune system will not work as well as it should. So is having a optimally working thyroid very, very important for immune system and for fighting off viruses and all types of things? Absolutely. And that's a huge part of what we're looking at, is being able to build up this immune system. So the liver, 60% of T4 to T3 conversion takes place in the liver. About 20% is taking place in the gut. So very many times we see patients that their liver enzymes are high, that they're out of balance that way, that their gut, their microbiome, they've got leaky gut, they've got dysbiosis, where that the good stuff and the bad stuff, you've taken probiotics, you've eaten sauerkraut or yogurt or things like that, those have been out of balance, and the bad stuff is up so high, the good stuff is so low that it's not going to be able to convert like it's supposed to. So we've got to fix the gut, we've got to fix the liver, but ultimately that's crucial to get the amount of T3 that we want in the body. Okay, so we have 2 types of autoimmunity with Hashimoto's. A lot of people have heard of Hashimoto's and they think it's autoimmune to the thyroid and it's attacking the thyroid. That is one type, and that is what's called TPO. And the TPO is the antibodies that we're looking for that are stimulating the body to attack the thyroid. The thyroglobulin antibodies are going to be the antibodies that are tagging the transportation for destruction. So some people have both, some people have one or either or of those. So if you're attacking your own thyroid, what would we expect to see? Well, a lot of people go, well, you'd have low thyroid. But a lot of times we'll actually see high thyroid hormones sometimes as well with these, because what happens, has anybody heard of Armor or Nature Thyroid? Give me a thumbs up if you've heard of those. And go ahead and write in there what it's from, if anybody knows where that source is. So Armor and Nature Thyroid are actually, they are glandulars, meaning it's made from pig thyroid. And we get that, good job guys, we get that pig thyroid into a little capsule, and we get T3 and T4 out of it. Where levothyroxine is just T4, Armor Nature Thyroid is going to be T3 and T4. So some people do better on it, some people don't. It just all depends on the person. I'm not a doctor that says, hey, you need to be taking this natural form and it's gonna be better for you. I don't know. Everybody's different. Some people do better on levothyroxine, some people do better on Synthroid, some people do better on Armor, Nature Thyroid, West Thyroid, whatever they're taking. As long as you're feeling good, that's what you need to be taking. Not just, oh, I want to be natural, so I'm going to do this. Some people just don't feel that great on it. But think about this. If you can grind up Yes, Stacy, that would be the desiccated form, correct? Desiccated, glandular, however you want to think about that. So look at this. If you can grind up a pig thyroid and it's going to go into your tissues and your body's going to use it as T3, T4, what happens when you've got autoimmunity going on to your thyroid gland and your body is breaking it down and destroying it? Well, you're going to have T3, T4 spilling over into the body, and sometimes we'll actually see elevated T3, T4 with Hashimoto's. And that's usually what we call an autoimmune flare. And most of you, I know one of you that was watching, she's experienced this, and that was not fun. And so this is very common, where if that immune system gets revved up, maybe we were exposed to a virus, maybe you are going through menopause, maybe you did go through pregnancy. A lot of things can stimulate that autoimmunity, and then it's going to drive more of that destruction, and we'll actually see higher thyroid hormones. And what would that mean to TSH? TSH would actually go down, and your endocrinologist or your doctor would say, hey, great, you're doing better. By the way, I always say, what was that TV show? Dirtiest Jobs, Worst Jobs, something like that. I think being an endocrinologist would be one of the worst jobs out there. And no offense to any endocrinologists at all, I know they work very hard, but think about this though. If somebody has Hashimoto's and that is going up and down and all around, it's very, very challenging just to have a medication and say, oh, we need to raise it, we need to lower it, we need to raise it, we need to lower it, because that's going to be basically chasing the tail instead of being able to grab the dog by the collar. That tail is wagging all over the place and you're not able to grab it. And so the last job I would ever want to do is be an endocrinologist, because then the patient is coming back in and saying, oh my gosh, I don't feel good, but hey, your numbers are looking good, so we're not going to do it. But they say, oh, I still don't feel good. Or you come in and say, I feel great, but your numbers are off, so then we change it, and then you don't feel good. And so it's just gets into that cycle again and again and again. And so unless you take a step back, it's going to be very challenging for you to get your health back, especially with your thyroid, especially if it's Hashimoto's. So on WebMD, if you look at WebMD and type in Hashimoto's, they're going to tell you that by taking your levothyroxine, your doctor is going to be able to stabilize your thyroid. Give a thumbs down if you've tried that and it didn't work. I mean, really, that is, it's just not a rational thought, because this is an autoimmune condition. The immune system is out of balance and it's attacking its own tissue. And if it's destroying it over and over and over, then we're not going to ever be able to stabilize, and it's going to be a degenerative condition. It'd be like to say, oh, you know what, yeah, you've got rheumatoid arthritis, your joints are being attacked, and all you have to do is go on an anti-inflammatory, or go on take some glucosamine chondroitin, something like that. No, that you wouldn't do that. Even in the medical model, they would put you on low-dose chemo, methotrexate, any type of steroids, all types of different things. But ultimately, we've got to stop that damage that's going on, and that's going to be the huge part of this process. So again, pituitary, which also tells the adrenals what to do, tells the thyroid what to do via TSH, thyroid stimulating hormone. Come this way a little bit. Thyroid stimulating hormone. The TSH, thyroid stimulating hormone, tells the thyroid what to do. So first thing you got to look for is your TSH in the good range? If TSH is too high, that's usually hypothyroid. If TSH is too low, that's usually hyper. But sometimes the pituitary will be worn out and we'll see TSH go down, even though somebody has hypothyroid. Yes, Lori Lynn, Graves is considered autoimmune. And so Graves is going to be a little bit more of a severe state, and that can lead to hyperthyroid, and that is actually could be life-threatening. So if we find somebody that has Graves or autoimmune and it's gone hyper, we've got to be a lot more careful with that than with Hashimoto's just low thyroid state there. So again, we can have hypopituitary that can not be stimulating the thyroid appropriately. So then from there, we've got to look at the T3 and T4. 93% of the hormone coming out is T4, 7% is T3. T3 is the active, usable form that we need to get to the tissues. But a lot of times what happens is we're not transporting it as well as we should. So some people may have enough thyroid hormone, and you need to look at total and free T3 and T4 when you're doing your examination with the blood work. And then if you have enough T3/4, very good chance that there's Hashimoto's going on to the thyroid globulin itself, and we're attacking that, or there's hormone imbalance, especially with estrogen, and there's a blockage and not able to transport that around like it should. So if somebody has enough thyroid hormone and they're just not getting it to the tissue, then it will show up where that TSH can actually go up as well. And then we see where T4 to T3 conversion may not be working as well as it should. Levothyroxine is T4, Armour Nature-Throid is T3 and T4. But if somebody's taking levothyroxine and they've got this beaver dam building up where they're going to be blocking that conversion into T3, we'll see excess T4, or at least at the higher end, and T3 at the lower end. That's usually an indication we're not converting like we're supposed to. And then ultimately that feedback to the pituitary, do we need more or do we need less? So then we've got the autoimmune side, the Hashimoto side, and that can attack to the thyroid itself, and that would be if you've had the antibodies done, TPO, or the thyroglobulin, the TG is the other one. So there's two Hashimoto's markers. A lot of people just think it's to their thyroid, but it's actually to the thyroid as well as the transportation of the thyroid hormone around the body. Some of the people, both of those are going on. Other people, it's one or the other. Just depends on the person. So that's the basic idea. Some people think it's basic, some people not. Remember, I said Saturday is our day to dive deep into more of the physiology, into different things that we're talking about. And so I'm giving a little bit deeper. If you've got questions, go ahead and put them down below. Love to answer any of those questions throughout this process. We'll keep this a running dialogue. If there's anybody that you know that has thyroid issues, like or share this with them. I'd love to get the information out and get the word out so that they can start taking full advantage of getting their health back to where they need to be. If you're interested in other information, anything else that we post on, helping the immune system, any of the COVID-19 antibody stuff that we're working on, like or follow us. And there's a button in that upper right corner you can look at there and push. Okay, so again, what happens with that autoimmunity? The good news is that the autoimmunity that is going to be triggering, and that part of the immune system that's going to be triggering this Hashimoto's is different than the immune system that's working on COVID-19 and working on viruses. So that's the good news. There is no evidence that shows that people with Hashimoto's are at an increased risk for any issues related to COVID-19 or getting COVID-19, anything like that. So that's the great news. They're actually showing that just having an autoimmune condition is not a pre-existing condition, is not something that's predetermining whether somebody has worse outcomes with COVID-19. If somebody's, I'm going to do this because if somebody is on prednisone, is on methotrexate, is on low-dose chemo, is on any of those things, and they're suppressing their immune system, there is a chance that they could have worse outcomes that way. So let's see, Jesse, does iodine have any effect in this process? So iodine is going to be what's actually helping to make T3 and T4. So it's one of the cofactors in production of T3 and T4. There are some people that can get an autoimmune flare by taking iodine, so we're careful with who we recommend iodine to. And if you do have Hashimoto's, I would not take iodine unless you're under the care of a physician or provider that is going to be able to monitor that. So for some people, iodine can be great. For other people with Hashimoto's, it can be a problem. All right, so Tony Marie, what's a good diet to help? So one of the first things that we always look at, one of the best diets to help when we're talking about adrenals, pituitary, this whole process, and even the autoimmune, is to stabilize your blood sugar. So let me go ahead and change this up here. So this is going to be, I've got a lot of other videos, and my latest book, Blood Sugar Doesn't Lie, we get in depth into this. But blood sugar needs to be very consistent. But what happens when blood sugar spikes up or goes down, spikes up or goes down, is that we are revving up that immune response every time it goes up too high or every time it crashes down. And we're talking even 140 and even 70s can be enough, and the speed at which it is going up and down. So the best diet somebody can be eating for their thyroid and for Hashimoto's and for their immune system in general, and we've talked about this for immune system in detail, is a blood sugar stabilizing diet. But what is that? And I've talked about this in my book. A lot of places, I don't have a meal plan, a menu, a diet that I recommend for that because everybody's different. Some people, and we've gone through thousands of patients where we have them check their blood sugar. Some of them, every single fruit they eat makes their blood sugar spike up. Other people, every single grain they eat makes their blood sugar spike up. Other people can eat bananas and be totally fine. Other people, sweet potato is worse than white potato, makes it go up higher than white potato. So it's very individualized. You can grab my book on Amazon, and it'll go into detail how we go through that process. But it's very important to stabilize that blood sugar. That's going to be the biggest thing. I don't care if somebody's keto, vegan, paleo, all these different things, as long as they can stabilize their blood sugar, keep their immune system calmed down, and keep that inflammation at a good level. So that's where we want to start with, is stabilizing that blood sugar. All right, Mary Jo, hey, how are you? Ranges, T4 seem to vary 0.4 to 4, 0.465 to 4.68. I've seen all the way up to 5.5. Do these ranges change based on studies? So that is a great question there. So one of the things, and I've got other videos on this as well, is the functional medicine range for blood work versus the lab range. And so basically what we've got going on is that lab range, if anyone, give me a thumbs up if you took statistics. I took statistics, and for some reason I did not like statistics. But statistics, there's something that we talk about in there called a bell curve. And that bell curve is going to be the middle 90% or so of the people that go to that lab. So around here in Fort Collins, we have LabCorp, Quest, UC Health, Banner, Kaiser, all these different labs, and their ranges are all going to be a little different, but they're not going to be based on a healthy population. They're going to be based on the average person that's coming in. So vitamin D is an easy one to go through. Most labs say somewhere 30 to 100, but those numbers are going to vary a little bit depending on the lab. But our functional medicine range, where we found researchers have found what healthy people should be, is 60 to 80. And so that TSH, you were saying 0.4, 0.456, any of those numbers, we like it at 1.8, and then up to the 4.5 or whatever the lab says, 3 is our cutoff. So we're looking at a narrowed functional medicine range, what that healthy person should be, not just the lab range. And so that's what we're looking at as well. So again, anybody that's jumping on, go ahead and put any questions down below. I love interacting. And hey, how are you? Is anyone ever able to stop taking drugs like Synthroid? So yes, we have had patients be able to get off of medication like Synthroid, levothyroxine. Synthroid is going to be the same thing as levothyroxine. It's T4. T4 has to convert into that T3. And so here's the deal. If you have Hashimoto's, it's impossible to know how much damage has taken place with the thyroid. If it's been there for 20, 30 years and you've destroyed 30% of your thyroid, you may never be able to produce enough T4 on your own. If you're not transporting it around the body, then you may need some excess as well. So hard to say. My number one goal with people, though, is to take as little thyroid medication as needed to get the desired result, which is to feel good, right? So if you have to lick the pill once a day and you feel good, whatever. There's way worse drugs out there that you could be taking than thyroid medication. But ultimately, sure, I would love for the body, and especially if it's not Hashimoto's, if it's just a low thyroid state, or with that pituitary that we were talking about here, not communicating to the thyroid like it should, if it's a pituitary issue, then absolutely, that's going to be a lot easier to be able to help someone get off that medication. But if it is Hashimoto's, we don't know how much damage has actually taken place to that tissue. So, great question, Anne. All right, can thyroid be triggered by alternate day fasting? Suddenly thyroid gland hurts. Alternate day fasting. So here's what happens when we're talking about fasting. And one of the big things that we talk about with Hashimoto's is what is stimulating that autoimmune. So autoimmune, I don't care whether we're talking about MS, lupus, ulcerative colitis, alopecia, all these different autoimmune conditions, we've got to look at these underlying basic premises. So if you've got a piece of paper and a pen at home, write this down. So autoimmune, one of the first things that we look at is the adrenal glands. And so stressful events like sitting at home and worrying about COVID-19 and your family and who's going to die and are we going to get our economy back and oh my gosh, did I get somebody sick? All these different things that we're worrying about are going to be stressing the body, and a lot of times a major stressful event has contributed to that autoimmune. So then the alternate day fasting, the next thing I draw on here is blood sugar. And we know the number one stressor to the adrenal glands is blood sugar swings, especially blood sugar drops. So some people, especially people with Hashimoto's, especially people that are dealing with autoimmune, sometimes intermittent fasting is very problematic because you're waking up and you're pushing without being able to get some food into the system and stabilize it. So that blood sugar crashes down, the adrenal glands sit on top of the kidneys, they tell the liver to kick out stored glucose. And this is why we get fatty liver with people that have blood sugar swings, is that stores it in the liver, kicks it out, stores it. But ultimately, every time that blood sugar goes down too low, the adrenals tell the liver to kick out glucose. And that's where that stress comes into play, is that it's adrenals. And if you're going 6-8 hours first thing in the morning without eating, or you're fasting full days, and you have these issues going on and you can't stabilize that blood sugar and you have adrenal fatigue and you've already got autoimmune, all those things, we see it sometimes where intermittent fasting is not a very good technique to do. So intermittent fasting is not the be-all and end-all, and it could actually rev up that immune response, and suddenly that thyroid gland could hurt. And I have Hashimoto's and believe I had COVID-19. It started on February 20th and still having issues. It hit my lungs. I can't see the rest of the message there. But yes, absolutely. Some people can, I wasn't saying that if you have Hashimoto's, you can't have COVID-19. What I was saying was there's nothing in the research showing that an autoimmune condition in and of itself, especially Hashimoto's, is going to make it more likely to get COVID-19, have worse outcomes, anything like that. But if somebody's on prednisone, if somebody's on methotrexate, low-dose chemo, Humira, those type of immunosuppressants, there is a bigger risk for people with COVID-19. Shoot me a message if you want to talk at all, or we can get on the phone if you want some ideas of things that I'd recommend if your body's still kind of fighting stuff off. Stacy, what's the book called? Sorry if you couldn't find Dr. Karazian's name. It's Why Do I Still Have Thyroid Symptoms? And then something about when my blood tests say I'm normal or something. But just Google, why do I still have thyroid symptoms? Jesse, all right. Is there a functional medicine program that you would suggest? You are a nurse practitioner. So a couple different ones, and if you want everyone to get on the phone, I can give you some specific ideas. But there's a master's program out of Western States University that is really good. I've known some people to do that one, and then there's a couple online programs. It just depends what you want to do, how in depth you want to get, what type of practice you want to get into, some of those things. So direct message me, or you can email me at doctor, DOCTOR, at fmcenters.com, and I'd love to jump on the phone with you or send you some ideas there as well. All right, Jim, great. We were getting to that. What about Hashimoto's and Epstein-Barr? And this is where even COVID-19 can come into this. We know that there is a lot of people that have a virus component to their autoimmune. So one of the other things that we always draw off of this autoimmune is infections. And many types of infections. If somebody gets Lyme disease, if somebody does get Epstein-Barr or gets stung by a West Nile mosquito or some type of infection, H. pylori, a lot of different things can drive that autoimmunity and can stimulate the body to go haywire. So I would not be surprised at all if a lot of people that get COVID-19, they have that potential to rev up the immune response and stimulate that autoimmunity. We know one of the things that can happen with Epstein-Barr is it can actually settle into the thyroid, and the body, this is a lot of new research coming out now, the body can then attack the thyroid itself, as opposed to just saying, oh, let's attack the Epstein-Barr. It'll actually attack the thyroid and look like an autoimmune condition. The other thing that happens is if somebody looks like they've got Hashimoto's, quacks like it, walks like it, all those things, and we run the antibodies and they don't show up, guess what shows up? Again, we're getting technical today, but stick with me. Lymphocytes. Lymphocytes goes up with a viral infection. White blood cell count, low, that means chronic viral, and the liver enzymes are high. Guess what? We know viruses affect the liver. That's why chronic hepatitis, a lot of these things have liver components to it. So the three things you want to look for Epstein-Barr, if you've got your blood work in front of you, less than 5 on your white blood cell count. You want to look at lymphocytes. If you're looking at the percentage, you want to be under 40, so don't be over 40 on those lymphocytes, and you don't want your liver enzymes over 20, AST, ALT. So those are the 3 things that you want to look for if you are going to be potentially concerned about Epstein-Barr or a chronic viral infection. And we see this all the time in people. If somebody looks like they have Hashimoto's but they don't, almost always have that trifecta of low white blood cell count, high lymphocytes, and high liver enzymes. So this is one of the concerns with COVID-19 and this new virus coming around, novel, meaning new, that it could be stimulating autoimmunity in the body. There's a lot of research coming out in the last year or two that Epstein-Barr is not just related to Hashimoto's, but also to MS, to some other autoimmune conditions, that it's in the body and it stimulates that body to attack its own tissue. Oh, Stacy, my blood sugar one. It's called Blood Sugar Doesn't Lie. And so just look up, Google my last name, GALYARDT, or on Amazon. And I've got 2 books. I've got one, Rebuild Your Brain, Stop the Damage, Start the Repair, and then Your Blood Sugar Doesn't Lie. Those are the 2 books I've written in the last few years. So you can grab those. Yes, Jesse, blood sugar doesn't lie. Okay. And then, yes, I'm chronic active, EBV, and Hashimoto's. Yes, Jim. So until that immune system gets better, until you can calm down that infection and stop that overactivation from that Epstein-Barr, it's going to be very challenging to get that Hashimoto's under control. But don't get so laser pointed and say, oh my gosh, I'm an Epstein-Barr patient and I've got to fix that. That's the only thing that I got to focus on. You've still got to address all these different factors. You've got to get the adrenals balanced out and different things that we look at there. If you are in a sympathetic dominant state, fight or flight, go, 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 go. Your body is going to be revved up and it's not going to be able to digest. It's not going to be able to repair, rebuild, all those things. You're going to be driving your adrenals all day long. If your blood sugar is jacked, there's no way you're going to be able to stabilize your immune system. Dr. Karazian says every time that blood sugar goes up too high or down too low, you rev up the immune system and you destroy more thyroid tissue. So that happens all the time. We've got to get it stabilized. Then we've got to get our vitamin D stable. I like it 80 to 90 for people that have autoimmune conditions. We've got to fix leaky gut. We've got to figure out, one, if somebody has leaky gut, but then also fix that. Absolutely crucial if this is going on. Environmental. Some people, if they're in a moldy environment, some people, if they're around chemicals, a lot of different things can drive that autoimmunity, those infections. Again, H. pylori, there's gut infections, there's a lot of different things that could be contributing to that. Hormones. Hormones, especially estrogen, but if you look at women, estrogenic events, having a baby. I diagnosed 3 young women, teenagers last year with Hashimoto's in 1 month. Why? Because they had gone through puberty. Puberty had triggered that with that hormonal effect of those estrogen changes. And then you've got the menopause, you've got going on birth control pill, you've got all these different things that are going to be revving up that body and causing that underlying imbalance. Everybody's favorite, right? Gluten. Gluten looks close enough to the thyroid in some people that immune response is going to get revved up to attack gluten, but it'll also attack the thyroid gland. So gluten or food allergies in general, we've got to stabilize that out. So there are a lot of different things, Jim, that you've got to do besides just addressing that Epstein-Barr. You've got to balance everything else out so that it can function as well as possible. And there'll never be that one, oh good, I fixed my Epstein-Barr, now everything else is better. You've got to address all these other things if they are out of balance too. Does increasing vitamin C help with autoimmune body swelling? I wouldn't say necessarily that it's going to increase with the swelling. There's a lot of reasons why we might get swelling from that autoimmune, and it may not be that the autoimmune is causing the swelling. It may be that the body is unwell and unhealthy, and then it's getting swelling, and the autoimmune is going on at the same time. So what that means is that yes, vitamin C maybe short-term could help. Vitamin C, we're actually seeing it help with IVs and things with COVID-19 patients that we talked about this last week, of the decoupling of the hemoglobin from the oxygen, and vitamin C can help with that. But remember, if you have swelling in your body, it usually indicates inflammation. It usually indicates the body's solution to pollution is dilution. Solution to pollution is dilution. So we're holding on to fluid, trying to dilute some of what's going on there. So what does that mean? Well, it's not necessarily an autoimmune thing that's causing the swelling. It's more of the imbalance, the ill health, the swelling that comes along with it that is causing the autoimmune. And we've got to get the body healthy first. And we never just come in and say, hey, this is how we're going to fix your autoimmune. Here's our autoimmune protocol. Here's our Hashimoto's protocol. That won't do it. If you walk into an office, sit down with somebody, and they say, you're going to go into our Hashimoto's protocol, get up and walk out, because there is no such thing. Every patient is unique. Some patients that have Hashimoto's are going to be high iron. Some are going to be anemic, low iron. Some are going to be diabetic. Some are going to be hypoglycemic. Some are going to swing 100 points in one day. Some people are going to have a viral infection like Jim. Some people are going to have a bacterial infection, H. pylori, different things in the gut. So it has to have that individualized approach. There's no one size fits all. Jesse, what helps balance adrenals? One of the big things we do in the office and at home is what's called neurofeedback. So we'll do a brain map on patients, and almost, I'm going to say 95% of patients that come in with autoimmune have what's called high alpha. Alpha is our relaxed or meditative wave. And if somebody has excess alpha, their brain is going to be spinning, thinking, worrying, stressing, not able to shut it down, all those things. And what happens then is that you're never going to get into a repair, rebuilding, restoring, digesting. That sometimes we were talking about that constipation. Sometimes that even inhibits digestion, causes us to not move our bowels like we should, all those type of things. So A lot of times we have to work on the brain to calm that down, get people out of that fight or flight. I've seen people come in for 6 years, they've been taking adrenal supplements and still have adrenal problems. There's no perfect cure for adrenals. I'd love to say, hey, here's my magic adrenal supplement compound, take this and you'll be fixed. Yes, there's certain things like ashwagandha and phosphatidylserine and some different things that are going to be helpful, but there's no one size fits all there either. But calming that brain down is one of the best things you can possibly do. So at-home neurofeedback or in-office neurofeedback are two of the best tools. And I really think that makes us one of the big differences why we're different than everybody else out there and why we get the success when a lot of people can't, is because we are addressing that brain and addressing what's going on there. I've been in practice since 2001. I've tried a lot of different things, but to just give somebody some adrenal support or some brain calming support, very, very challenging. But if we can change the brainwave pattern, huge, huge difference. Yes, the inflammation, so the body swelling. So vitamin C, it can be helpful for that swelling, but really, again, we've got to get to the why. Why is the body swelling? Why is there inflammation? Why do we have these things going on? And that's the big thing that we're talking about is functional medicine is about that underlying why, the underlying what is going on, and we've got to correct those. So again, if we have Hashimoto's, we have an autoimmune. And guess what? If you have one autoimmune condition, well over half the time you've got more than one. So there's a very good chance if you have Hashimoto's that you've got another autoimmune condition going on. Could be attacking the brain, could be attacking the gut, the pancreas, the joints, all types of different systems in the body. So you've got to calm this down. No one's going to die from Hashimoto's. You'll never feel good. You'll never be your ideal weight. You never have good energy, whatever. But you'll never, you won't die from that. But what will happen, very often people will have another autoimmune condition going on. So we've got to fix that. If you guys have any other questions, go ahead and throw those below. I'm going to be wrapping up in a couple minutes here. Like or share this with anybody that you know, anybody that's dealing with autoimmune of any kind. This is the same process that we're going to do with anybody. Also with Hashimoto's, thyroid, if you have not had your antibodies tested yet, shame on your doctor, because LabCorp, $15 to do Hashimoto antibody test. Everybody should know. If you have low thyroid, high thyroid, whatever, you should have had your Hashimoto's antibodies tested. So if you haven't, get those tested ASAP. We run those in our routine panel on everybody all the time, along with rheumatoid factor, along with lupus, ANA markers, along with C-reactive protein, all types of different things. We've got to get that whole picture figured out, and we've got to do it very, very quickly, because all of these things are the stuff that's going to be problematic when we're talking about COVID-19, when we're talking about inflammation, when we're talking about bad outcomes, going back to work, getting exposed to this virus, all types of different things. Why do some people, 60% of the people that get this virus and exposed to it like that and develop antibodies have no symptoms? Why is that? Because it's the state of the host. Some people are going to be able to fight it off. I just got my antibody test back this week. I have no IgG, no IgM. And I guarantee you I've been exposed to this. I flew in March. I've been around patients. I've been a lot of different places and grocery stores and everything else. And yet I have no immune response to it, just like I haven't had the flu for probably 20 years. And is that because I've never been exposed to the flu? I get exposed probably every day of the winter from people, from my kids. I got 4 boys going to school. There's germs everywhere. And yet my host is okay with it. And that's what we've got to get you. Instead of cowering in your basement, afraid and stressing and wearing out your adrenals and then eating poorly and not getting your sunshine with your vitamin D and then not breathing good fresh air and all these things, we need to be getting your body stronger to be able to handle this. Stabilizing your thyroid, fixing your autoimmune, that's what we need to be doing as opposed to just waiting this out and hoping that it goes away. You need to take action. You need to get your body as strong as possible so that it can handle any of these things coming your way. We do complimentary consultations all the time. I'll sit down 15 minutes with you over the phone or in person and let you know exactly what I think's going on, what the process could look like to get your health back. And we take people all the time, take them by the hand, get them where they need to be. Last week I had a new patient in Nebraska, one in Breckenridge, one in Pueblo. We see patients all over the world. So whether you're local to us, whether you're in Phoenix with our new satellite office going down there in the Functional Medicine Center of Arizona, any of these places where we have offices, we are here to help. We can do things remotely with you. Feel free to jump in and give us the chance to talk to you about what's going on and let you know what you might be able to do to get yourself better. So, all right, thanks everybody for jumping on. Hope you learned something today. Keep that immune system working as well as you can. Get your thyroid working. Make sure that autoimmune calms down. And if you got any questions at all, drop me a line. Otherwise, like and share this. Follow us. We try to hit videos every day and give you updates on all the things out there. So take care, everybody.